Good morning, everyone. It's with great sorrow that I am here to announce that Chicago Police Department has lost a second officer from complications related to COVID-19. Sergeant Cliff Martin was a very special officer. A 25-year veteran of the department, he served in the Area Central Detectives Division, earning more than 60 department awards over the course of his long career. But more than that, Sergeant Martin was a Chicagoan through and through, and he proudly served the city he loved. Superintendent Beck will provide more details in a moment, but let me say this. Our hearts go out to Sergeant Martin's wife and his 3 children, who are now grieving over the unimaginable loss of the husband and father who was taken from them so suddenly by this terrible disease. I had the opportunity to speak with Sergeant Martin's widow, and even in her grief, she said that her husband would want his death to serve as a warning to civilians that they must stay home. Sergeant Martin gave his own life in the service of others. And it's a testament to Sergeant Martin's own commitment to public service that 2 of his children have followed in his footsteps by becoming Chicago police officers. Our first responders are making daily sacrifices to protect the lives of others. I say to anyone who is listening, don't make their sacrifices be in vain. Stay home and save lives. And when you do leave, whether it's to purchase groceries or because you're an essential worker, please do so with the utmost of caution. And most of all, do not congregate. Do not force our officers to be called upon to break up gatherings in our parks and streets. This disease is real and it is deadly. And when you do gather, you're not only putting yourselves at risk, but you're putting our officers at risk as well. Remember, even if you're not sick or showing symptoms, you may still be carrying and spreading this disease. Whatever progress we've made in fighting COVID-19 has been because the vast majority of Chicagoans have been playing by the rules. Our only way through this crisis and preventing more loss of life is by continuing to stay safe and act responsibly by staying home. As we've seen throughout this crisis, it is literally a matter of life and death. Thank you, and with that, I'll turn the podium over to Superintendent Beck.
It is with great sorrow that we come together again to talk about the passing of one of Chicago's finest. Sergeant Martin truly epitomized what is great about Chicago and its police department. He was a veteran of 25 years. During those 25 years, he investigated hundreds of homicides and trained dozens of other detectives in the arts and skills required for investigation. Strong family man, 3 children, 2 of whom became Chicago police officers. He grew up in a housing development in Chicago. He worked his way forward to become one of the most respected detectives in Chicago Police Department. The tragedies pile upon each other, and they make our hearts heavy. But the men and women of the Chicago Police Department go out every day. They can't stay home. They can't shelter in place. They have to do their jobs, and they do them very well. When I talked to Cliff, when he tested positive, his first words were that he was concerned about his family. He wanted to tell me about his children, and he wanted to tell me how bad he wanted to come back to work. What a tremendous heart, and what a horrific loss for not only his family, but for all of Chicago. Chief of Detectives Dinahan knew Cliff very well. I was privileged to have talked to him once or twice, but Brendan will have much more to say about the man, who we will miss sorely and who will be remembered forever in the hearts of the Chicago Police Department. Brendan?
Good morning. I was, my name is Brendan Deanahan, Chief of Detectives, and I was fortunate enough to be able to work with Cliff for many years in Area South or Area 2, where, as the superintendent mentioned, he worked with his partner Shirley, and they cleared a lot of murders, they worked a lot of murders, and Cliff was just, he was an excellent detective. But more so than that, I spoke with his wife, and she wanted to know people to know, just how caring and grateful and concerned Cliff was for others. And that's the real Cliff, not just the the detective or the sergeant, Cliff Martin. He truly loved his wife and his children. He was so very proud of all three of his children. He was especially proud when his son and daughter joined the police department. Just a very proud moment. He was able to pin the star, and his daughter was able to pin the star on his son. Cliff would even send his kids a police tip of the day, his wife told me, where he would text them tips on how to handle certain assignments that he knew they would encounter while on the job. He was a great sergeant. He was a sergeant in Area Central, where I was once again fortunate enough to work with Cliff. And now Commander Mills to my left had worked with Cliff as well. But as a sergeant, he always just wanted to be with his guys. He would often remark, he just wanted to teach the detectives the right way to do the job and the right way to do things in general. He had told his wife Robin on April 4th that he wanted to thank the UFC staff that cared for him, and that's just how Cliff was. He told his wife specifically, he insisted that she thank Dr. Kraft, Dr. Maldonado, Nurse Sue, and Nurse Flo, who he referred to as a godsend. So even going through this entire process when he was in the hospital, it was Cliff who said that the doctors and the nurses are the real heroes who are doing God's work. Cliff also told his wife, he gave her a list of department members who he referred to as his people and his guys, and he wanted his wife to message that out, that these were the people that he respected most on the department. And he wanted to thank the entire police department for everything that was given to him. But I think that it was Cliff who gave back and served, and I just he'll be greatly missed.
Good morning. My name is Paul Bellata. I'm the president of the Chicago Police Sergeants Association. I worked on the south side of Chicago some years back, and Cliff and I crossed paths a few times. I remember him as a very good policeman and a very good man. And this tragic loss in our rank hurts all of us right now. It's with a heavy heart I tell you this, that my heart goes out to his family, his wife, his children. My prayers go out to them and all the members affected in our department with this terrible virus. Thank you. I'll turn it over to Mayor Lightfoot.
Thank you, folks. We're happy to take any questions you might have. Okay.
So can we start with Superintendent Beck? Is that okay?
Sure, of course.
I have a question from Jesse Kirsch, WLS. So can you give us details about how the sergeant got the virus? Was it from work? Was it elsewhere? How long was he sick before he died? And he died yesterday, so he was in the hospital, I'm assuming, right?
He was hospitalized. He'd been hospitalized for 2 weeks, I believe. He first got symptoms on the 20th of last month. He went off sick on, I think, the 22nd. That's the day I called him. As far as how he got it, that's a matter of speculation. If I knew how everybody got this virus, I would probably be working for Chicago Department of Public Health and not its police department. Unfortunately, this is a very, very difficult murderer to trace. And I think that is the key to this. Is how do we go back and find out where it came from?
You just called it a murder.
Well, it's obviously a death. I mean, if you want to ascribe the cause of death by the virus, I guess you could extrapolate that it's a murder by virus. But that's not a technical term. That's a term of art I just used.
So do you have a sense of how this COVID virus has spread in the department, even in Area Central? How many people are on count today?
So as of today, we have 237 members who have tested positive. We have just over 1,000 who are off sick for things which may be related to the virus, but there's no way to tell at this point. That's 8.2% of our workforce. It's remained pretty steady over the last week, although as testing becomes more available, our count continues to climb as far as those that are tested positive.
So with Sergeant Martin, what happened after he tested positive? What did you do at Area Central? Did police officers who came in contact with him get quarantined?
Well, so when the sergeant tested positive, I know that Chief Dinahan talked to the men and women that work Area Central, made them all aware. It was well known. We did a cleaning of the workstation, advised those that had come in contact with him to self-monitor, and if they got any symptoms whatsoever, to stay at home. You know, we don't, as per CDC and Department of Public Health advice, we don't quarantine just on contact. You have to have symptoms or some really aggressive contact.
But with the general public, it's if you have contact, correct?
No, it's always about symptoms.
Okay, because we've
well,
had people who have died and their families are quarantined for 14 days.
That's close contact, right? It's a little different. And I wish Dr. Arwady was here, but I've listened to her enough that I know what she would say. She would say this is a virus that is transmitted by close personal contact. That close personal contact occurs oftentimes in the home. So living with somebody is different than having more casual contact, i.e. in the workplace or in the kind of setting we're in now. So that's why family members are generally quarantined.
Okay, a lot of questions from WLS, if you don't mind. Can you update sick calls for CPD today?
I just did, a little over 1,000, 8.2%.
Okay. Having to go through an abbreviated funeral memorial like we did yesterday for Officer DeFranco, how much more difficult is it to mourn these officers when you have to keep your social distancing?
Well, it is different, that's for sure, and I think that anybody that's involved in this, even those that are sick, understand why we have to do it, and it is, part of the job of the living is to protect others, and so it's very important that we do it that way. I think that we managed to do something that was very respectful, that showed high traditions of the Chicago Police Department, but was as safe as we could possibly make it.
Now, just questions on PPE. So either you or the mayor want to answer those? Charlie, you're going to do that?
What do you got?
I got a bunch.
Is it in general about the police department or about the city?
There are a couple things.
Give me the ones about the police department. The mayor can handle the ones about the supply chain in the city.
Okay. PPEs with the police department. The mayor has said, the governor has said, you've said that officers have everything that they need, but that's not what I'm hearing. That's not what a lot of other reporters are hearing, that they're struggling. Community activists just delivered a bunch of PPE equipment to Area Central. There's a lot of concern there. So why are there two different stories? What exactly is going on?
Well, there are tremendous concerns by our employees, but we have put out over 18,000 PPE kits. Last Saturday, we put an additional 42,000 masks. We have hundreds of thousands of pairs of gloves. I think that people want some magic protection when there really is none. And I understand their difficulty because we all face it. And so, is there sufficient PPE out there for the moment? I believe there is. As this progresses, will we need more? Of course we will. Will it be difficult to get? Probably. But as for right now, I feel confident that we have provided enough. Now, anybody that doesn't have it, what I would ask is that they contact my office directly, and I will look into it. But we've had huge amounts of supplies delivered to our districts, and you know, I know that everybody would like to have a trunk full of masks. That's just not the reality. Nobody has that. Nobody nationally, or even our medical personnel don't have that. But do we have enough that everybody has an adequate supply? Yes.
From Laura Washington, for Superintendent again. The Hill is reporting that young African Americans are being profiled for wearing masks in public during the coronavirus pandemic. 2 men in downstate Illinois reported they were being followed by an officer inside a Walmart store. Has CPD had any incidents like this? Have you had to talk to them about situations like this?
You know, I don't know of any incidents in CPD like that. I mean, the general population is wearing masks at a very strong rate, so I can't imagine looking at that as out of the ordinary. As to what happened in a Walmart downstate, I have no idea.
I'm done with Superintendent, yeah.
Mayor, I have a few off-topic questions for you. The first one is from John Greenfield at Streets Blog. Cities all over North America are doing open street programs to create car-free or car-restricted space for socially distanced transportation and recreation. Would you consider reopening the Lakefront Trail to bikes only and/or doing an open streets program in Chicago?
The Lakefront's not reopening anytime soon. As people are aware, there's lots of bike lanes and bike trails throughout the city. When we closed off the Lakefront, we coordinated with a lot of advocacy groups to encourage people to use one of these alternative means of transportation, and that's what folks should do.
Then our next question is from Greg Pratt at the Chicago Tribune. Dr. Arwady told the Tribune she was taken by surprise by Governor Pritzker's announcement of new testing sites in Chicago, and that she would have liked to have been consulted by the state on the sites. What are your thoughts on this situation, and did the state do enough to consult with the city and keep you guys looped in?
Well, obviously there was a problem yesterday, and we're going to work to rectify that so we can all move on. I think what the public expects, and rightfully so, is that all units of government are communicating with each other and that there's collaboration because there's not a minute to waste, and we'll continue to do our part to make sure that that happens.
And then our last question is from Mitch Armentrout at the Sun-Times, and it's about the smokestack at the old Crawford coal plant that was demolished this morning. Was it a good idea to implode the smokestack at the old Crawford power plant this morning, sending a cloud of dust through Little Village during a pandemic?
Well, obviously the decision to make changes that were not the ones of the city, but our Department of Public Health and inspectors, upon learning that this was going to happen, were actively engaged with the owners of the property and making sure that there was precautions in place so that there was no more dust, if you will, than a normal demolition. And we'll continue to monitor the circumstances on the ground there to make sure that people are safe.
That's all I've got.
Mayor Lightfoot from WLS again. Is there anything more to do for first responders trying to acquire any added PPE for themselves? Are you recommending that people give them things, people donate to them, just because we know they don't have quite as much as they need?
Well, I push back on the last part of your question. As Superintendent Beck said, from the very beginning of this pandemic, our primary concerns were making sure that our healthcare workers had the resources that they need, and of course our first responders. The Department of Public Health has literally pushed out millions of pieces of PPE to healthcare and first responders. Everything from N95 masks that obviously need to go to healthcare workers and those that are actually treating people who are ill, gloves, masks, gowns, the whole gamut. And we will continue to do that. And as Superintendent Beck says, there's a difference between want and need. And we have been doing everything that we can to make sure that the needs of our first responders are taken care of, and we will continue to do that. So there should not be a circumstance where someone who needs gloves or a mask doesn't have them. And the presumption that our first responders have now been given is that everybody that they come into contact with, they should presume that they have the possibility of being sick and taking the necessary precautions. So I think my sense is, because this is an issue that we monitor on a daily basis, is that our first responders have the resources that they need to be able to do their job. And if they don't, then they should contact Superintendent Beck. But there is a difference between want and need.
One more question. Is there ever going to be a time before this vaccination comes or before this pandemic is over where everyone will be able to get, healthcare workers, city employees, first responders, will get the PPE that they need constantly?
That time is now.
But you just said that there's not enough.
No, I did not. No, I did not.
Superintendent Beck, I think, did.
No, I don't think that's what he said. What I said is the priority that we have made from day one is to make sure that our healthcare workers and our first responders have the protections that they need. In a typical situation, the Chicago Department of Public Health doesn't provide private hospital workers with PPE. That's something that is typically the responsibility of those institutions. But in these unusual times, they have, the Chicago Department of Public Health has pushed out literally millions of pieces of PPE because we know that our healthcare workers and our first responders need to have the equipment necessary to keep them safe while they do their job. So we are constantly in conversation with everybody in this ecosystem, first responders and hospital workers, to make sure that they have the protections that they need, and we will continue to have those conversations to make sure that if we need to supplement the work and the materials that the hospitals normally provide to their workers or that our first responders need, we're going to be there for them. So you ask, is there ever going to be a time? That time has been present for weeks now.
Thank you both. I'm done.
Okay,
Thanks.
thank you.